name is Jordan, and I'm one of the leaders for this week. I'm going to try for the third time to get this video to upload and work correctly for me. But this week's leaders, we were talking about some instances of social injustice and unethical situations. The first one that we were asked to review was the story of Henrietta Lack. So just a small summary about that. Henrietta Lack was a poor African American woman who went into the hospital for some abdominal pain and bleeding. Ultimately, it was discovered that she had cervical cancer. During one of her hospital stays, one of the physicians took cells from her cervix and did this without her knowledge. Ultimately, a few short weeks after, the patient passed away at 31 years old, still never knowing that any cells were taken from her. The cells that were taken were used for research that has brought the healthcare system leaps and bounds. It helped with polio vaccines and just really advanced healthcare. And she had no idea, and her family had no idea that this had happened. Ultimately, the family was approached by another research company because they wanted to do some blood and samples from other members of the family as well. And this is kind of when the family found out what it was going on. There was a lawsuit, and ultimately the family settled with the research company, and it was all closed, and no one knows how much or anything like that. But some of the questions that we were asked to address were, what factors do you think were responsible for Henrietta's cells being taken from her without her permission? The first factor that I think immediately is that she was a woman. She was receiving an exam for the cervical cancer, an extremely vulnerable situation, and they were able to access that without her really knowing what was going on. She just thought it was some routine testing. And then the next big one, during this time, it was the 1950s. Racism was hot and heavy. The reading states that this was the time when there were black and white areas of the hospital. It says that she was in the colored part of the hospital is what they referred to it as. So I just think because she was a black woman and was poor in this time, that these doctors were coming in and they just honestly thought that they could take advantage of the situation, and that she would never know. And they didn't have the same respect for her as they had for the white patients, so they truly just seems like they did not care. What factors do you think were responsible for her family being kept in the dark about so many ways in which the study of her cells contributed to the medical science? It says that her cells were used for years and years before her family ever knew anything. I think it was like 60 years after her death that anyone even knew. And I think that she just came from a poor family. Again, it was the 1950s. The United States was divided. There was discrimination. There was such a divide that they just thought that this poor black family wouldn't find out. And if they did, they didn't have the knowledge or the money to fight it. So I feel like they just thought that they could get away with it without any consequences and that it would be fine. And honestly, this was something that happened all the time. There was not a lot of ethical practice going on during this time. The next topic was asks about how the code of ethics can provide guidance in situations like this. So there are lots of provisions that kind of address the topics that are apparent in Henrietta's case. So provision number 1, which states that nurses will practice with respect and compassion for all individuals. This was obviously not something that was going on in the 1950s with the racial divide, but that nurses are to practice with respect and compassion regardless of race, ethnicity, culture, gender, any of those things, social class. And then provision number 3 states that a nurse is to advocate and promote for patients' rights in their health and safety. And this was something that was not done for Henrietta either. Her patient rights and her safety were all just not present in the situation. She was in a very vulnerable state and was very much taken advantage of. Provision number 6, which states that nurses are to maintain and improve and even establish ethical environments. Again, this environment that this took place in was absolutely everything but ethical. And then provision number 7, this touches on informed consent. Again, in the 1950s, informed consent was not something that was super popular. It's hard to believe that, because now that is something that we believe so wholeheartedly in, is that making sure our patients understand absolutely everything that is going on with their care. And then provision number 8 is just saying that the nurse is going to collaborate with all health professionals to make sure that their human rights are protected. Again, Henrietta's most basic human rights were not protected in this situation. One of the other readings addresses another ethical concern, that is the Tuskegee syphilis study. This was something that I found super interesting, just because it's something I'd never heard of, and it is just mind-blowing that something like this was allowed to happen. So this is an experiment that took place in 1932. In this time, syphilis was rampant all over the nation, and several research groups were studying syphilis. And one of the research groups had this idea that maybe race affected the progression of the disease. They thought that syphilis affected the cardiovascular system in black people and the neurological system for white people. So PHS is who conducted this experiment, and they worked to collaborate and recruit black men who were said to have a non-contagious form of late-stage syphilis. So they recruited over 400 black men with late-stage syphilis, and then 200 black men who did not have syphilis, and they used the 200 for their control group. The idea of the entire experiment was to assess how syphilis would progress with minimal treatment. Who's going to sign up for that? No one. So the participants were actually told that they were going to get drugs for free to help cure their condition. And they were, one time. Each one got one form of treatment, and then the rest of the drugs that they received were placebos. They did all kinds of painful spinal taps and labs and all the things to try to assess for any neurological effects that syphilis had. And they just continued their research. They even went to the extreme of funding the funerals for the patients that died, just so that they had the right to perform the autopsies to further investigate any effects that the syphilis might have had. In their documentation, they referred to all of their patients as volunteers, which again was untrue. They were very much recruited, thinking that they were going to get a treatment. During this process, like I said, several research groups were studying syphilis, and penicillin was found to be a cure. However, this group continued their research on the racial differences and withheld that knowledge from their patients. They went through great lengths to make sure that their patients did not find out that penicillin was a cure. They even went through the trouble to keep the total of 600 men that they had in their study out of the draft for the Army, because they did not want them to get a hold of penicillin and find out that they cured their syphilis. Such a bizarre thing to me. But ultimately, they were found out. A man named Peter Buxton found out what they were doing. He took it to the authorities, and it was ultimately thrown out. They said that, they did not agree with him. It was just not a big enough concern for them, but ultimately he leaked the information he had to the news, and they were found out about what they were doing. Um, so both of these situations are extreme violation of patients' ethical rights, just extremely unethical practices going on, and just things that we don't see these days because of our code of ethics that we go by. But going back to Henrietta's case, it says that they settled with the research group. Uh, it's a super sad thing, but money is such a driving force. Anytime anything goes wrong, give them some money, let's settle, let's make it worth their while. So my question is do you think that Henrietta's family's views would have been different had the research group given them profit from the beginning? Or do you think that they would have continued to think that it was unethical what they did? Um, so if they call them up and say, hey, we took these cells from your relative this many years ago, it's now showing advancements in healthcare and we're making money off of it and we want to share that money with you. Do you think they would have been as mad had they gotten the money up front? Do you think they would have even acknowledged that how her cells were obtained was unethical? I think this is such an interesting topic, and there are so many ways that you can look at it, but I can't wait to hear you guys' response. Thank you.